If your bone marrow is damaged, it needs to be replaced with healthy bone marrow. It's not like a kidney or a liver, so there is absolutely no risk for the donor. In the long term, chemotherapy and radiotherapy can have side effects. It's not a surgery, it's not an operation, but it's not a recovery period either. It's a period of staying in the hospital. Choosing the right clinic is extremely important.
Bone marrow transplantation is BMT, which is well known to everyone facing blood cancer, etc. It's an issue that is necessary to address. That's a very common question. Why? Is it possible to get by without a bone marrow transplant? And why is it often impossible to recover without it? You can get by without it, but you can't recover. And by the way, another common question, is it possible to prepare from the transplant in the country where you live and then, for example, come for the transplant itself? That's also an important question, an important point. So let's be clear that preparation is not the transplant itself by itself. That's a general part of the process. Andrei Beltsovsky from Memorial Baslivler Clinic, Istanbul, talking about bone marrow transplantation with a pediatric professor with an oncology professor. Let's go. So, friends, as you can see, entry is forbidden for everyone here. Why intro? Because this is the children's ward. Because this is the unit where children stay after transplantation, after bone marrow transplantation. As you can understand, our topic is bone marrow transplantation in children, because so many of you asked after our video in Ankara. So, once again, we'll be answering your questions. As usual, we're at Memorial Baslivler, and before we enter this special clean zone, they'll suit us up, and we'll be talking to the doctor. So, friends, today we'll be addressing the most pressing questions about transplantation right here from Turkey, from Memorial.
Hello, I am Dr. Muge Gundabdu, professor in the Department of Pediatric Hematology and Oncology. Right now, we are in my bone marrow transplant unit. There are 10 rooms here for young patients who are undergoing cancer treatment. Here, we perform bone marrow transplants and chemotherapy for children with various types of cancer. I have 15 years of experience in treating children. Currently, I work at Memorial Baslivler Clinic. Here, we have a bone marrow transplant unit for children. We treat all types of cancer, such as leukemia, lymphoma, brain tumors, renal and abdominal tumors, and bone tumors. Our clinic also has a radiotherapy department, where patients can receive any type of radiotherapy depending on the type of cancer. In pediatric cases, the role of radiotherapy is especially important. During a radiotherapy session, the child must remain in a static position without moving. That's why, first, the child is given anesthesia, and then the radiotherapy session is carried out. The clinic also has a pediatric surgeon and a radiation medicine department. All of these departments help us provide comprehensive treatment for the patient. We also have a pediatric intensive care unit for emergency situations where all necessary measures are taken under the supervision of the attending physician. This work is done in close collaboration with colleagues. It's not just my job, it's a team effort. Our clinic has all the departments and specialists we need. Bone marrow transplants are required, in particular, for diseases such as acute leukemia, acute lymphoma, and various types of hereditary anemia, such as thalassemia, Fanconi anemia, and Diamond-Blackfan anemia. For all these types of hereditary congenital diseases, a bone marrow transplant is indicated for the patient. Medicine has identified a number of diseases that originate in the bone marrow. If your bone marrow is damaged, it needs to be replaced with healthy bone marrow. About 20 years ago, we couldn't perform this procedure in our country. Over time, with the advancement of medicine, we have reached the point where we can perform this procedure and treat a number of diseases. Here is one of the rooms in our department. Each room is equipped with a HEPA filter, and the air circulation goes not from outside to inside, but from inside to outside. Thanks to this, the patient doesn't get any air from outside. We enter the room by passing through 2 doors. We don't want all these doors to be open at the same time. First, we enter the anteroom area. Here, we put on special clothing, wash our hands, and wear a special head covering. There is also a restroom in this area. It is intended for the patient only. There are 3 types of bone marrow transplantation: autologous, allogeneic, and haploidentical. The autologous type is usually performed for brain tumors and lymphomas, while the allogeneic type is used for diseases such as leukemia and thalassemia, when the bone marrow function is impaired. We can perform an allogeneic bone marrow transplant from a brother or sister, or from an unrelated donor, from a bone marrow bank. We work with the Turkish National Bank Turkok as well as European banks in Germany and Switzerland. If we are unable to find a suitable donor, either related or unrelated, we can perform a haploidentical bone marrow transplant. A haploidentical transplant means a transplant from a half-matched father or a half-matched mother. Every day, the success rate of haploidentical bone marrow transplants is increasing worldwide.
Friends, how many times have you seen a gift shop in a hospital? My memorial. You see, there's a cool tradition here. For all patients, whether they're staying or being discharged, there's a special store so you don't have to wonder what to give as a gift. There are flowers, there are all kinds of toys for little kids, older kids, and adults. It's such a cool thing, a gift shop. And as I always say about Starbucks, don't forget about it.
This isn't surgery. It's not an operation. We give the donor a special injection. After that, the stem cells enter the bloodstream, and we collect the stem cells from the donor's vein. It's not a surgical procedure. After the cells are collected in a special container, we transfuse them to the patient intravenously. Hospitalization is not required for this. The donor is discharged from the hospital the same evening. There are no problems for the donor. Right now, I have a 5-year-old patient, and the donor is his brother, who is only 6 months old. I will collect cells from the 6-month-old donor, and these cells will be transfused to the patient. Bone marrow has the ability to regenerate itself. It's not like a kidney or a liver, so there is absolutely no risk for the donor. If you are healthy and between the ages of 18 and 55, you can also become a donor and have your materials stored in the bank. This does not cause any harm to your health. Bone marrow transplantation is an individual process, and the preparation for it is also personalized. If possible, I prefer that we prepare the patient at our center, because the patient needs to undergo a comprehensive examination. But in some cases, before the bone marrow transplant, the patient first receives chemotherapy. In these cases, the patient can receive it in their own country, and when they are ready, they can come to our center. But for a number of diseases, the patient comes directly to our center for preparation and the subsequent transplant. For example, with leukemia, chemotherapy can be done in the patient's own country, but with aplastic anemia or thalassemia, the patient comes straight to us. In our department, one of the parents, either the mother or the father, stays with the child in an isolated room for about a month and a half. But this is not the recovery period, it's the period of being in the hospital. The recovery of the immune system takes from 6 to 12 months. After being discharged from this department and already being at home, it's important to continue following all the requirements for cleanliness, hygiene, and sterility. There are a number of rules regarding eating and lifestyle, and it changes after a bone marrow transplant. Over the course of a year, the immune system recovers day by day. A patient is considered healthy 1 year after the transplant. And after we've prepared, we open the second door without touching the button. Just bring your hand close to it. We enter the patient room. Here is the patient's bed, and here is the parent's sleeping area. An HEPA filter is installed here for special air circulation. All the necessary equipment is here, allowing us to turn this room into an intensive care unit in seconds. If the situation requires it, we can easily make that happen. Of course, during the bone marrow transplant period, patients receive chemotherapy and sometimes radiotherapy. In the long term, chemotherapy and radiotherapy can have side effects. For example, years after the transplant, some problems may arise with the heart, kidneys, liver, vision, and hearing. That's why after a transplant, a patient should not only be monitored by a hematologist, but also get checkups with a cardiologist, endocrinologist, ophthalmologist, and ENT specialist. A patient who has undergone a bone marrow transplant needs to see all of these specialists regularly. Choosing the right clinic is extremely important. You should find out in advance what departments the hospital has. For example, if there is a pediatric intensive care unit, it's a good idea to visit and see the department with your own eyes. Because not all transplant centers have the same high level of quality. You need to gather information, you need to see for yourself. Having a team of experienced nurses is very important. The success rate of transplants performed at a particular center is also important. You also need to talk to the responsible doctor, the nuclear medicine department, therapy, pediatric surgery, pediatric intensive care, and make sure there is an experienced team and a good department overall. All these factors are important when making a decision. Here in the ward, the joints with the ceiling are designed in such a way that dust doesn't accumulate. There are no curtains here. We use blinds. The sofa is made of a material that is easy to clean. The water in the bathroom is purified using ultraviolet light because when taking a shower, there is a chance that water can get into the mouth or ear canal, so we sterilize the water with UV. Each ward has its own HEPA filter. The circulation system is not connected to other wards. You can also see a filter at the bottom of the door for air movement. Patients do not leave this ward until they are discharged. In emergency situations, when a patient presses the emergency call button, we can open both doors at the same time. Our nurses have extensive experience in bone marrow transplantation. During working hours, they are not allowed to leave the department. They have their meals right here. They cannot go outside and stay here all day. Children can bring their own toys, iPads, or PlayStations to make their time in the ward more enjoyable. I am a professor in the Department of Pediatric Hematology and Oncology and have extensive experience in bone marrow transplantation in children. To date, I have performed over 1,000 bone marrow transplants in children. My success rate is over 90%, and we continue to work in this field.